bodies require various vitamins and minerals in order to thrive. Most of these nutritional necessities can be found in whole, non-processed foods such as fruits and vegetables. However, our modern diet of overcooked, processed, and fatty foods is lacking in these essential nutrients. Therefore, many people take vitamin and mineral supplements. Many over-the-counter supplements now contain vitamins that are easily absorbed and used by the body. In addition, many supplements today contain minerals that are chelated, which means they are bound to small protein building blocks called amino acids. Chelation helps the tiny minerals to move more easily across the intestinal wall into the bloodstream, and then from your bloodstream into your body's cells. Once inside your cells, vitamins and minerals can catalyze or promote chemical reactions in your body that are needed for good health. The tonsils are two glandular lumps of tissue located on either side of the throat. If your tonsils have not been removed, you can usually see them by opening your mouth and looking at the back of your throat in a mirror. The function of the tonsils is to trap bacteria and viruses that might enter the body through the throat. Once the tonsils have trapped a foreign invader, they produce antibodies to fight off infection. However, sometimes the tonsils themselves become infected. When this occurs, you may develop a fever and a sore throat with red, swollen tonsils that often have white spots on them. If a doctor determines that the infection is bacterial, antibiotics will be prescribed. However, since tonsillitis can also be viral, do not allow children to take aspirin products because a serious disease called Reye syndrome could ensue. The tonsils are two glandular lumps of tissue located on either side of the throat that trap bacteria and viruses and fight infection. However, sometimes the tonsils themselves become infected by the foreign invaders. Tonsillitis, or infection of the tonsils, results in a fever and sore throat with red, swollen tonsils that often have white spots on them. Frequent bouts of tonsillitis may require a tonsillectomy, or the surgical removal of the tonsils. There are many ways to remove the tonsils. However, the method most often used today is electrical cauterization, in which a surgeon uses electrical energy applied from an instrument to remove the tonsils with little bleeding. Undergoing a tonsillectomy generally does not affect a person's ability to ward off infection. When we eat or drink, food and liquid containing sugars and starches are often left behind on our teeth. Bacteria that also lives in our mouth combines with those leftover substances and forms an acid. The acid can eventually destroy the protective enamel covering on our teeth, causing holes or cavities called tooth decay. Tooth decay can lead to infection, causing pain and inflammation. The dental pulp is soft tissue that is filled with nerves, blood vessels, and connective tissue. It lies beneath the enamel of the tooth and reaches from the crown of the tooth to the root. If decay reaches the dental pulp, a root canal is required. During a root canal, the pulp tissue is removed and the canals are cleaned and filled with medicine. A permanent seal is put in place once the infection is completely gone. Your gastrointestinal system, including your stomach and intestines, is filled with many tiny microorganisms. Some of these microorganisms are good bacteria that help your body digest and absorb food and protect against disease. However, your intestinal system may also contain bad bacteria that can cause intestinal distress and negatively affect digestion. Unfortunately, times of stress or illness, or use of certain medications, may decrease the numbers of good bacteria within your body. As these populations diminish, they are no longer able to control the growth of the bad bacteria that are already in your digestive system or enter your body when you eat. As these organisms grow in number, they may cause bloating, gas, cramps, and diarrhea, which may in turn affect your ability to absorb nutrients, thus increasing your risk of illness. However, there are products on the market today that contain various types of the good bacteria or probiotics. Taking these supplements may help you maintain a healthy balance of intestinal microorganisms that promote digestion and prevent the discomfort of intestinal distress. The liver is a vital organ in the upper right side of the abdomen. It has several life-sustaining functions. It processes nutrients, produces proteins, stores sugar or glycogen, controls our hormone levels, blood sugar levels, fluid retention, and cholesterol. The liver filters unwanted substances and helps our bodies fight infection. Injury to liver cells from alcohol abuse, hepatitis B or hepatitis C, or intestinal bypass surgery can gradually destroy the liver. When liver cells begin to die, the lifeless cells are replaced by scar tissue. Scar tissue blocks the circulation of blood through the liver, leaving it unable to store nutrients and filter unwanted substances. During liver transplant surgery, the diseased liver is removed and replaced with compatible, healthy liver. Recovery in the hospital can last from 1 to 2 weeks. Periodic blood tests will evaluate how the new liver is functioning. The liver is a vital organ in the upper right side of the abdomen. It has several life-sustaining functions. It processes nutrients, produces proteins, stores sugar or glycogen, controls our hormone levels, blood sugar levels, fluid retention, and cholesterol. The liver filters unwanted substances and helps our bodies fight infection. Injury to liver cells from alcohol abuse, hepatitis B or hepatitis C, or intestinal bypass surgery can gradually lead to cirrhosis of the liver. If the cause of the injury continues, say for example an alcoholic continues to drink, the liver cells begin to die. Those lifeless cells are replaced by scar tissue, which cannot perform the same functions of the liver cells. Scar tissue blocks the circulation of blood through the liver, leaving it unable to store nutrients and filter unwanted substances. Symptoms of cirrhosis include fatigue, nausea and vomiting, weight loss, bruising, and jaundice. Treatment methods may include drug treatment, dietary restrictions, and even liver transplant. Cirrhosis of the liver can be stopped if the underlying cause is removed early enough. The damage to the liver is irreversible, but symptoms can be controlled. A hernia is a swelling of an organ or tissue through an abnormal opening in the body. There are several types of hernias, but the inguinal hernia occurs in the groin area, where part of the intestine slips up through a tear in the abdominal muscles and protrudes through a weak spot in the inguinal canal. An outpatient surgical procedure is normally required to repair an inguinal hernia. A small incision is made over the groin area and the segment of bowel is placed back into the abdominal cavity. The muscle is stitched closed to repair the hernia. Inguinal hernias are common in children and usually appear before an infant is 1 year of age. In adults, the cause of a hernia is unknown, but it is commonly thought to be associated with lifting heavy objects. Nearly 15% of adults have a hiatal hernia that is never realized, while a small percentage feel painful symptoms after eating. When we eat, food travels through our mouth, through the esophagus, past our diaphragm, and enters the abdomen through a hole in the diaphragm called the esophageal hiatus. The esophagus joins the stomach just below the diaphragm. A hiatal hernia occurs when a portion of the upper stomach slips up through the hiatus and into the chest. Symptoms may vary according to the size and position of the hernia, but can include heartburn, chest pain, belching, and difficulty swallowing. Treatment of a hiatal hernia involves relieving symptoms by reducing your weight, eliminating smoking, avoiding large meals, and lying down after a meal. Medications can be prescribed, and occasionally surgical repair of the hernia is required. Hepatitis attacks the liver. The liver is a vital organ in the upper right side of the abdomen. It has several life-sustaining functions. It processes nutrients, produces proteins, stores sugar or glycogen, controls our hormone levels, blood sugar levels, fluid retention, and cholesterol. The liver filters unwanted substances and helps our bodies fight infection. Hepatitis is a virus that slowly travels through the bloodstream. There are several types of hepatitis, but type C is the most damaging form. The virus causes the liver to become inflamed. Healthy cells are replaced with scar tissue, leaving the liver unable to function normally. Prescription medicine can relieve symptoms and help your body fight hepatitis. It's important to avoid alcohol and certain medications that can cause additional damage to your liver. Throughout the entire body, blood vessels work constantly to pump blood to the heart. Blood vessels surround the anal opening as well. Sometimes, those blood vessels can become swollen due to constipation, diarrhea, pregnancy, or aging. The swollen blood vessels are called hemorrhoids or piles. Hemorrhoids can be internal, inside the anus, or external, under the skin around the anus. Some symptoms of hemorrhoids include rectal bleeding after bowel movements, painful bowel movements, and anal itching. Healthy gums are essential in order to maintain healthy teeth. Each tooth is surrounded by gingiva, the gums, the cementum or root surface of the tooth, connective tissue, and bone. Bacteria that adheres to the surface of our teeth produces a sticky surface that traps food particles and creates plaque. Gingivitis occurs when plaque builds up on the tooth and gums, causing swelling, redness, bleeding, and infection in the infected area. Gingivitis can damage the teeth, roots, or nerves of the tooth and can lead to tooth loss if not treated. The gastrointestinal tract is about 30 feet long and includes the oral cavity, the pharynx, the esophagus, the stomach, and the small and large intestine. It is responsible for moving food and liquid into and out of the body. At the junction of the esophagus and the stomach lies a muscle called the lower esophageal sphincter, which opens to allow food to enter the stomach, and then closes to keep food and stomach acids from flowing back into the esophagus. If there is too much pressure in the stomach or the sphincter muscle is not functioning properly, then contents in the stomach can splash back into the esophagus, causing symptoms of GERD. Those symptoms may include heartburn, chest pain, coughing or choking while lying down, or increased asthma symptoms while sleeping. Diet and lifestyle changes can relieve the symptoms associated with GERD. However, in some cases, medication or surgery are necessary. When we eat, food travels through our mouth, down the esophagus, and into the stomach. The stomach produces acid and an enzyme called pepsin that aid in digestion. The stomach lining is protected from the digestive acids with a thin layer of mucus. An ulcer is a sore that damages the lining of the stomach. An ulcer can cause abdominal pain that occurs after a meal, nausea, vomiting, weight loss, and fatigue. Many gastric ulcers are caused by corkscrew-shaped bacterium called Helicobacter pylori. This bacterium can live on the lining of the stomach, damaging the lining and the mucus layer that protects the lining from digestive acids. Cigarettes, foods and beverages containing caffeine, alcohol, and stress may also play a role in the development of gastric ulcers. Many of us, in fact an estimated 16 to 20 million people in the United States, have gallstones. Most of them are so tiny they're literally flushed away. Gallstones develop in the gallbladder, which is a small pear-shaped organ located under the liver on the right side of your body. The gallbladder is used as a storage tank for bile that is produced by the liver. Bile is an enzymatic fluid, some call a digestive juice, that helps our body break down foods that are high in fat. If we eat fatty foods, bile travels to the small intestine to help with digestion. Bile is made of a perfect combination of elements like water, cholesterol, fats, bile salts, and bilirubin. If this mix becomes unbalanced, for instance too much cholesterol, crystals form and harden and can continue to grow, which can be very painful when the stone tries to travel through the tiny opening into the small intestine. Symptoms of gallstones may include a steady, severe pain in the upper abdomen, nausea, or vomiting. Many of us. The gallbladder is a pear-shaped organ located below the liver in the upper right-hand side of the abdomen. It connects to the liver and the intestine through small tubes or ducts. The gallbladder stores bile that is produced by the liver. Bile is a liquid substance that helps your body digest fatty foods. After you eat, your body begins the digestion process and the gallbladder contracts, sending bile through the intestines. If your gallbladder becomes infected, inflamed, blocked, or filled with gallstones, it may be necessary to remove your gallbladder. After the gallbladder is removed, bile is still produced by the liver, but it is continuously released to the intestines. Symptoms of gallbladder disease can include indigestion, abdominal pain, nausea, fever, jaundice, and rapid heartbeat. Gallbladder disease is most common in women, but heredity, diet, obesity, and age are also important factors. The digestive process begins in our mouths, where chewing tears the food we eat into smaller particles. An enzyme in our saliva mixes with these particles and begins to digest the food. This mixture then travels down the esophagus to the stomach, where the food particles are further broken down by acids and enzymes. From the stomach, food travels into the small intestine, where water and nutrients are absorbed, and then into the large intestine. In the large intestine, more water is absorbed, leaving only the waste materials that are left over from the digestive process. As these materials pass from the large intestine into the rectum, it expands until a point at which nerves in the area signal us that it's time to expel the waste. At this point, two circular muscles, called sphincters, control the passage of the waste material from the body. Both the internal anal sphincter, which is an involuntary muscle, and the external anal sphincter, which is a muscle you control, must relax to allow the waste materials to pass. Fecal incontinence is the inability to control the passage of waste materials, called feces, from the body. It often occurs as a result of disease or damage to these muscles and nerves. Treatment options include biofeedback exercises to improve sensation and muscle control, or surgical repair of the damaged muscles. Digestion begins in the mouth, where we physically break down foods with our tongue and teeth. The food particles then travel to the stomach, where they are further digested by the acidic stomach juices. As food leaves the stomach and enters the small intestine, several digestive fluids are added. These fluids contain enzymes, which aid in the digestive process. For example, the pancreas secretes 3 enzymes into the small intestine: amylase, protease, and lipase. These enzymes are also produced by the intestinal wall. We also get important enzymes from the foods we eat. However, modern cooking practices and food processing kills many of these enzymes before we ingest them. This lowers the amount of enzymes in our digestive system and slows the digestive process. Therefore, many people take supplements that contain plant enzymes that catalyze or stimulate the digestion process. These supplements often contain amylase, protease, and lipase, enzymes that help take some of the work away from organs like the pancreas, which may be under undue stress due to modern eating habits. Each of these enzymes have special binding spots called receptors that help it match with and bind to a particular type of nutrient. For example, amylase digests carbohydrates, such as the starches found in potatoes and pasta. Proteases help the body break down protein found in foods such as meat into tiny building blocks that can then be used to build and maintain the body's tissues. And lipases help the body break down fats and oils, which may help lower the amount of fat circulating in your bloodstream. During the digestive process, all of the foods that we eat, carbohydrates, proteins, and fats, are converted into glucose, commonly known as blood sugar. A hormone called insulin is produced by the pancreas. Glucose is the food for our cells and circulates in our bloodstream. But our cells cannot absorb glucose alone. Insulin must first bind to the cell's surface, which then activates the cells to absorb glucose. That process lowers our blood sugar level back to normal. In type 1 diabetes, the pancreas does not produce enough insulin, so glucose cannot refuel the cells. In type 2 diabetes, insulin is produced, but it doesn't work properly, so glucose is not consistently absorbed by the cell. Both have the same results. Glucose is not being absorbed by the cells. So that's why people who are diabetic have high blood sugar levels. Without the proper absorption of glucose out of our bloodstream, our cells are starving for food.
Your colon is coiled up at the end of the long tubular digestive tract located in your abdomen. It acts as a waste processor, taking digested food in the form of solid waste and pushing it out of the body through the rectum and anus. The lining of the colorectal tube is a prime breeding ground for small polyps or tumors to form and grow. Many of these polyps are benign or non-cancerous, but others are malignant tumors. Colon cancer can occur in men or women and is most often found in people over the age of 50. Some symptoms of colon cancer may include persistent constipation or diarrhea, blood in the stool, and unexplained fatigue. As with most cancers, early detection is the key. Regular screening tests may be done on patients who may be at risk, like those over 50, or those who have a family history of colon cancer. When we eat or drink, food and liquid containing sugar and starches are often left behind on our teeth. Bacteria that also live in our mouth combines with those leftover substances and forms an acid. The acid can eventually destroy the protective enamel covering on our teeth, causing holes or cavities called tooth decay. Tooth decay can lead to infection, causing pain and inflammation. Regular brushing and flossing helps rid the mouth of remaining particles and helps reduce the risk of tooth decay. The large intestine is a horseshoe-shaped organ that is part of the digestive system. When fully extended, the large intestine can stretch to 5 feet in length and 3 inches in width. It coils up in the abdomen and prepares and stores waste material before defecation. The appendix is part of the large intestine. It is a small, finger-shaped pouch of tissue located on the lower right side of your abdomen. Although it branches off the first section of the large intestine, it plays no vital role in the elimination of waste. The appendix can become diseased with bacteria from the intestinal tract. When infected, the appendix becomes swollen and inflamed, causing painful symptoms of appendicitis. Symptoms might include pain and tenderness near the navel area that moves towards the lower right abdomen. Nausea, vomiting, low fever, constipation, or diarrhea may also occur. An inflamed appendix is usually surgically removed during a procedure called an appendectomy. A delay in treatment could cause the appendix to rupture, causing an infection in the abdominal cavity.